with that, I am going to introduce our next speaker, who is Sionnach Lukeman. She is an assistant professor in the Rankin School of Nursing here at St. Francis Xavier University. Her alma mater, also my alma mater. She is currently in the second year of her PhD in nursing at University of Victoria. And I believe Marjorie MacDonald is one of the folks that she's working with there. Her research program really involves three disciplines: public health services and systems, political economy of health, and building supportive environments for health. Her practice background is maternal child nursing, and more recently public health as a content lead for Healthy Development Program. And I know that this topic of systems focus and health system restructuring and what equity does and public health does is going to happen in that is a huge interest. So that's where she's going to take us. So Sionnach, with that, I'm going to hand it over to you.
Thank you. Can you hear me okay?
Yeah, you're good.
Great. Okay, so thanks for the introduction, and what an honor to be involved in such an important discussion, especially with Dennis Raphael, who is really, I would say, the godfather of this whole area of research that I'm interested in. And so an honor and a little bit of a scary idea to be chatting together today. I really came to this topic from practice, and so that's my focus for this talk today, is to talk about sort of my experience with reform and restructuring and what that brought up in me and why that is the focus now of my PhD research. So before I begin, I would like to acknowledge, honor, and pay respect to the traditional owners and custodians of the land on which we meet. We are gathered here on an ancestral and unceded Mi'kmaq territory. So even though Diane did do this from the same location down the hall, I do think it's very important to say this each time that I'm speaking from a place of unceded territory. So who I am and why. I also think it's really important to identify my own social location and what perspective that might bring to the topic. So I am a white settler of Irish heritage. I am able-bodied. I am currently living in a sort of middle to upper class socioeconomic situation, although I did grow up in the social assistance, or what it was called then, the welfare program. So I was living in my mother was a single mother, and she had 4 kids and had to do all kinds of things to sort of make life happen for all of us in rural Nova Scotia. So I do think that's important to bring to the table. My practice background, so Diane alluded to this, that I was in a content lead position in public health. It was, it covered the kind of northeastern region of Nova Scotia at that time. I was in public health just before Nova Scotia went through a whole restructuring process. And so I was part of this major consultation process. I'm sure many of you are familiar with this, but there was a lot of kind of, okay, well, what is it that you do, all of you in your positions, and how do we now fit all of this work into a new structure? So what happened in Nova Scotia is that 9 health authorities became 1, and you know, everything completely shifted as far as organizational structure goes. Positions were lost, huge sort of management shift, so the positions of leadership shifted quite a bit, and teams changed a lot as well. Now, I went off on maternity leave when the actual shift happened, and then I didn't come back to public health. I took a position in academia. A little bit early for me, but I did feel in some ways that this was a place where I could be and talk about these kinds of things. So I really appreciated Dennis's candor. I do also teach an advanced population and public health course at Sionnach here in nursing, and we talk a lot about politics and economics and, you know, things that traditionally are not considered health focused. And I think it's really important for us to be able to have platforms where it's safe to speak like that, and I think, students need that. So I guess that's my practice background. I do maintain a connection with our association in Nova Scotia and also with the local or sort of Nova Scotia public health world as I continue in academia. And it really did inform all of that process of being in the middle of restructuring and having my position, or the position I would have gone back to after maternity leave, really change. And watching the moral distress that created within public health, feeling like the work was stagnant, feeling like, our progress on health equity was really being sort of tampered and diminished, even in the short term. And short term meant really quite a year or two of things feeling stagnant. And for anyone that, obviously all of you work in this area, the importance of maintaining really good teams and partnerships, I mean, it's all through those organizational frameworks of what makes health equity, what makes the work towards health equity, successful. And in the midst of reform, many of those things are either ignored or damaged. And so it is really difficult to work in the midst of reform and not feel like, are we ever going to get back to those places where we had some relationships formed with communities and other partnering organizations. So that's where it came from for me. I really felt like I needed to look at this closely and think, what happens when we're in the midst of this work and it's such a foundational piece of public health, health equity and social justice, and what then? How can we kind of move through this? And I wanted to understand it better because it is such an external force that happens to us. And is there a way for us to maybe be engaged differently? I really thought that Trevor Hancock did an excellent piece during the election about why health needs to be an election issue. And I think this really speaks to how timely talking about power and politics and economics in any health discipline and outside of health disciplines, even more importantly. And so I really like that he recommended that Cabinet have a committee on population health, and it's chaired by the Prime Minister, so really speaks to the kind of power for decision making that we need. And then there's also a need for an assessment of health impact of policies in all sectors, a spending review to reveal really where are the biggest health and human development returns on investment. And then also to displace the economic development as a central focus, so putting well-being at the heart of government. And I really liked that New Zealand has done that recently. And I use that in class as an example, and it's a really neat one. So I would like to hear from the group about whether you've been involved in a positive experience during health system reform that didn't derail those efforts to address health equity, and what made it positive. So I think we often talk about reform and restructure in a negative way, and there may be places that have done this well, and what could we maybe learn from that? So it would be great to hear from some of you folks, if there are any.
So yeah, people can type their answers right in here, and then everyone will be able to see this. This is a really tough one because I hear about lots of challenges, but it's not seeming like there's a lot of positive. Any positive even pieces of the restructuring? Maybe not the overall, but have there been stages or steps that have had a positive impact? In Ontario, they're definitely just at the beginning of restructuring. Oh, this is interesting. Sionnach is not much positive. Oh, okay. Yep. So implementing treatment is prevention for HIV required. Yeah, restructure. So that's good. So maybe some of the what is to come, some of the benefits to come aren't realized yet because it's new, right? Bad time to ask for Alberta. They've shifted it right as of very last election. Corporations rule. Implementing treatment, right, there's the HIV one. Alberta introduced a $15 minimum wage in Alberta. This is really interesting. Okay.
Yes, the dedicated health equity consultant. So great mention in Nova Scotia that that was an important shift, that in the restructuring there were now teams dedicated to health equity that had consultant leads, and also now there's a health equity position in the science and systems performance piece that is absolutely essential to moving the work. And actually Christine Johnson is in that role, and she was part of this rapid review that I'm talking about today. So yes, I agree that that was a positive piece. Great.
Okay.
So I've worked with Diane on this blog the last year. It actually is the baby of my honors research student, Charlotte Reardon, but I had gotten a grant, and I asked her to come work with me on this. So this was sort of the early stages of me trying to figure out what is out there. So when we have public health reform, what happens to population health outcomes? What happens to communities? What happens to all others involved? Does it work? You know, is there a point of, you know, maybe we're missing something here? Maybe there is a positive side of things here that I don't know about. And so it was really important for me to go to the literature and see what do we have to learn from, or at least to understand this better. And so Charlotte is a recent graduate of our nursing program, and we're working on a manuscript for this rapid review right now, so we're getting close to submission.
Which is good, Sionnach. There's been a lot of interest in your in your work on that, and a lot of people have been touching base with us to find out more, so that's good.
Yeah, and I think that just speaks to the fact that we have very little evidence on this topic, and I kind of knew that going in before we did the rapid review, just with sort of preliminary searches. And you know, it was really important to have Christine Johnson part of this process, because she is that health equity lead. She's sort of really immersed in the literature a lot. She's also really immersed in practice, and you know, it was important to have that piece there. So a really great team, and also, you know, the team at NCCDH did help us to kind of guide the writing and make it meaningful for practice, which is always my goal. So some of the background, none of this will be new to you, but some of the reasons why I felt like we needed to think about this system in a different way maybe, or describe it and pay some attention, is that it is being described in the literature as in crisis, under attack, under siege, and weakened. There's all kinds of reasons for this, and I think, you know, Dennis speaks about power and politics, and really sort of the power of the business and industry sector in Canada, and how our public health system is just largely ignored. So this constant system reform without evidence to support decisions is pretty difficult, and it does affect how we move forward with health equity. So the impact of public health system characteristics on health outcomes, especially related to health equity, is still not understood very well. Now this reference comes out of the US, but it is very pertinent for Canada as well. Now, the sort of area of research that I'm interested in here, or the name that it's given, is Public Health Systems and Services Research, and I'm working with Marjorie MacDonald, who has sort of been immersed in this for quite a long time, and we're working on a couple of grants to try to get some momentum in Canada on this, because there has been some momentum in the US, and it would be really great if we could understand better the organization, financing, and delivery of public health services in Canada. So that really is, you know, what works well, what frameworks are there, how could we do this better? So really the goal is to improve population health and reduce health inequities. So another question for the group would be, how do we weather the storm of political and economic forces and maintain a true commitment, achieving progress with health equity? So are there ways to protect ourselves? I'm wondering what others might think.
Maybe it's unknown, right? So how do we weather the storm? What are some of the things that we can do, right? Join your public health associations. What are some of the organizational, what can be done on an organizational level to maintain and establish that commitment, right? Join public health, grassroots, keep being the squeaky wheel, again and again and again, building capacity, embedding the work through the organization. So what are some of the ways we can build it into organizations and build some of that capacity, right? I know that I've heard of organizations who build it within their strategic plans, might build it within operational plans. Increasingly, there is some interest in building it within the actual structure of an organization by having a health equity department, for example, that does that work across topics. Volunteer engagement, value for money. This is really interesting, Sionnach, eh?
Very.
Okay.
One thing that I do spend some time on when I'm teaching a fourth year course with nurses is the difference between advocacy and activism, and what are the sort of tensions that arise when you move into that activism role, and do we need to maybe do more of that? Because just as we're talking about public health maybe not, or in Canada really not moving forward with the determinants of health piece and addressing inequities, nursing is often talked about in a way that essentially saying that we are silent on many of these issues, even though we are a huge number of health professionals. And there's lots of reasons for that, but I do think that teaching much of what is in this sort of chat box here is really important for anyone working on health equity. Great. Thank you.
Go ahead. I've shut the poll. Go ahead.
So I'm going to briefly talk about the rapid review. We looked at the literature from 2010 to 2018. We really wanted to know how the restructuring of public health systems impact population health outcomes. We screened 234 texts, hand-searched reference lists. We found 7 articles, and honestly, the first run of search terms only got us 2, and then we hand-searched and got 7. So, and no Canadian evidence. So we ended up having to broaden and go to international literature. And I wasn't surprised by that, but that is an important finding. I think that piece itself needs to be published to say, listen, in Canada, we don't understand what happens to population health outcomes when we restructure public health systems. So the results kind of from the international literature suggest that increases in public health spending can contribute to improved population health outcomes, that improvements in the organization, the system organization, like increased staffing and improved infrastructure, can lead to better pop health outcomes. And the impact of public health system reform on health equity is often negative or inconclusive. So we don't have good evidence around what does help us at the system level. What does that system look like that can facilitate progress towards health equity? I have another question for the group, and this is really, for me, as I move forward with my PhD program and my area of research, what evidence do we need? I would argue that we don't need more descriptive evidence. I think Dennis has said basically we have all of this evidence to suggest that we are in trouble, that we aren't near making sort of progress that we would like to make, and I think one of the important pieces around political economy of health that Dennis referred to is really laying bare political and economic forces that influence this work. So that external force that really does present a major disadvantage in public health as we work towards health equity.
Comparative data, outcomes, cost-benefit analysis. It's so hard, right? The cost-benefit analysis is so hard, but if our evaluations can somehow be including those cost and economic types of implications, it would be good. There is lots of, broader data on that, but it's hard to link to specific initiatives. And lots of qualitative data. Sorry? What's that?
I appreciate the comment about sarcasm.
I don't know if I've seen that one yet. I'll have to, is there a way to quiz the politicians on their understanding of health equity and public health? Well, yes, there is. We may not get it's hard to tell what we'll get for answers though, right? So the qualitative data and storytelling is always an interesting one to me, right? Because, even when there's numbers and lots of numbers that impact and storytelling from the communities, but also from practitioners about how things happen isn't always present. So I'll leave it for another second, Sionnach, when you resume talking, but I do want to let people know that when I do an update to folks before Christmas, I'll do a follow-up, I'll include these polling answers as well so that people can learn from that. So this is interesting. Okay.
Mm-hmm. Very useful.
Okay, I'll probably end it. I'll probably move it off now if that's okay.
Great.
Okay, great. There you go.
Thank you. So this is, I just put my references up here for anyone that was interested. And yeah, I really appreciate the dialogue and the ideas. And really, I'm in that phase of my PhD program where this is very useful for me, and I really do want to make sure that I'm still engaged in practice. So I appreciate the opportunity to speak to you, and looking forward to questions and discussions. Thank you.
Thanks, Sionnach. It was, I just think that this whole area is, the truth is it's happening whether we like it or not, right? The reform piece is happening whether we like it or not. So I guess the question is, how do we influence it, and what do we want to do about that? So